Hey guys, this is a session on barbiturates, which is a example or which is a division of the sedatives and hypnotics subclassification. So all the barbiturates are derived from the barbituric acid. Remember this, they are usually derived from the barbituric acid, and these are usually non-selective CNS depressants, and they mainly act on many sites, and it mainly acts on ascending reticular activating system ARAS site. So it's one of the most common sites for the barbiturates to act. The mechanism of action is quite same for all the sedatives and hypnotics, the same one as we have studied in the benzodiazepines. Same continues for all the three categories, that is barbiturates, benzodiazepines, and non-benzodiazepines. As we know, the barbiturates, which is divided into three types, that is the long-acting, short-acting, and the quite short-acting ones, and their respective examples. These barbiturates mainly binds to the GABA receptors, as we have studied. There is GABA receptors where usually GABA and the chloride ions or these benzodiazepines or the barbiturates or the non-benzodiazepines, all these binds here, and due to this binding, what happens? The chloride ions will move inside the cell intracellular. From extracellular to intracellular, all the chloride ions will move, and therefore the chloride concentration inside the cell increases and leads to hyperpolarization state. Okay, so what happens? Same thing, it binds to GABA receptors, and the duration of the chloride channel kept open and it's increased. There is increase in the chloride current, there is increase in the chloride conduction. It leads to membrane hyperpolarization and finally causes CNS depression. Next one is the definition. That's what I've said. It's mainly derived from the barbituric acid. What are its actions? We know the first, it's mainly acting on the CNS because these are the drugs which mainly acts on the central nervous system. They cause sedation, they cause hypnotics, they mainly try to decrease your anxiety, and it might also cause euphoria. Euphoria is like you are in an excited state, you feel very pleasure and you feel very hyperactive. It also might leads to hyperalgesia, which is there is the increase in the sensitivity to the pain. Your pain receptors get like highly activated. It also might cause anesthesia in increasing doses. There is loss of pain in your body. You don't feel any pain because there is damage in the pain receptors. Or it might also cause the anti-convulsant effect, that is anti-epileptic effect. What is its effect on the respiratory system? It might cause the respiratory depression and it might cause the respiratory paralysis. It might paralyze all the respiratory muscles. Its action on cardiovascular system is it will decrease the blood pressure and decreases the heart rate, and therefore it decreases the cardiac output and in turn decreases the stroke volume and decreases the peripheral vascular resistance. What is its action on skeletal muscles? It mainly acts as a muscle relaxant, and it decreases the neuromuscular junction excitability because it's inhibiting there. Once again, moving on to the actions. CNS, it causes sedation and hypnotics. It decreases the anxiety. It has the anti-anxiety property, anti-convulsant property. It causes euphoria, that is excitement, pleasure, hyperalgesia, that is increase in sensitivity to pain, anesthesia, that is loss of sensation in the body, and anti-convulsant effect, anti-epileptic effect. In the RS, it mainly causes respiratory depression, respiratory paralysis of the muscles of the uh, of your respiratory system. It on this cardiovascular system, it mainly decreases the blood pressure, heart rate, which in turn decreases the cardiac output, stroke volume, and the peripheral vascular resistance. On the skeletal muscle, it acts as a muscle reluctant and decreases the neuromuscular junction excitability. The next is again the actions of this classification in detail I have written. So, sedation and hypnotics, as I have said, it mainly decreases the sleep latency, duration of REM sleep, and they have the low therapeutic index effect because they mainly rebound the increase in the REM sleep. They also caused marked respiratory depression, produce marked hangover effects, headache, drowsiness. You have the high degree of tolerance and drug dependence on the drug. Like after you start to take the drug, after 3 4 days, you feel like taking it again and again. You get very dependent on the drug, and they also cause drug interaction with many other drugs or with the potent enzyme inducers. The problem is they do not have any specific antidote, so you cannot treat it. When you cannot treat it, that problem will try to increase and increase. So you shouldn't be dependent upon that drug a lot. Next is general anesthetic effect. As I've said, the ultra short acting barbiturates such as thiopentone and methotrexate, these can be used for the induction of the general anesthesia. It is also used as anticonvulsant, that is the phenobarbital, which is the long acting drug, long acting barbiturates, which has an anticonvulsive effect, and therefore it's used in the treatment of status epilepticus, which we'll study in the general anesthesia chapter, and the generalized clonic tonic seizures. And it also might cause the neonatal jaundice of non-hemolytic type by the phenobarbital, because when you use a lot of phenobarbital, usually these are the drugs which has a longer duration of time. That is the one drawback. Then it what will it do? It mainly reduces the serum bilirubin level, and it causes the increase in the metabolism of bilirubin because there is increase in the enzyme of GT, that is glucuronol transferase. Therefore, there will be reduction in the serum bilirubin level. What are its adverse effects? General, it's drowsiness, confusion, headache, ataxia. Ataxia is like you'll forget everything and you will lose your body. Sorry, ataxia means you won't be having the proper balance or position. You won't be able to stand properly. You'll be having that gait, uncontrolled gait thing, and hypotension, respiratory depression, etc. It also might lead to skin rashes, itching, swelling of your face. That's what I've said. Tolerance, when you get addicted a lot, it causes the drug dependence on the drug. It also causes the sedative and hypnotic actions on the repeated use. Physical and psychological dependence develops on the repeated use, and prolonged use of the phenobarbital may cause the megaloblastic anemia because there is decrease in the absorption of folic acid from the gut. So, acute barbiturate poisoning. What happens here? So when you consume a lot of barbiturates, it causes poisoning inside your body. The symptoms are the drowsiness, restlessness, hallucinations, hypotension, respiratory depression, and paralysis, convulsion, coma, and finally it might lead to death also in a severe condition. Treatment is mainly the ABC, that is, you have to maintain the airway, breathing, and the circulation, maintain the electrolyte balance in your body. It should be like there are more cation or more anion. Everything should be balanced. Nothing should be more or nothing should be less. Everything should be in a balanced condition. You can also do the gastric lavage, where you after you wash the stomach, you administer the activated charcoal, which eliminates all the longer acting phenobarbitones. But thing is, you have to do endotracheal incubation. Intubation is performed before the gastric lavage to protect the airway in unconscious patients. You have to do a process called as endotracheal intubation, which is performed before the gastric lavage. You can also treat the patient with the alkaline diuresis, where there is no like, see, we know that there is no specific antidote for barbiturates. So you can also treat with these are nothing but the Second option kind, you can do the ABC thing. You can try to maintain the electrolyte balance. You can do the gastric lavage, endotracheal intubation. You can try doing the alkaline diuresis, where the NaHCO3 sodium bicarbonate, which alkalizes the urine. And you can also try to do the hemodialysis in the severe condition. So that's it. This is the acute barbiturate poisoning, which they can easily ask for 3 marks. And this question, the non-benzodiazepines or barbiturates, is usually asked for the 5 marks thing. And even the benzodiazepine, they are also asked for 5 mark question or 10 mark sub question. So that's it about the barbiturates. Hope you have understood this video. Please do comment, like, share, and subscribe. And if you want me to uh, do lectures on any other topics, please do comment in the comment section. Thank you.